Well, good morning, everybody. This is Jody Susan with Susan Essentials, and we have a special guest here today, Dr. Frank Lawless, and he is the inventor of the BAUD, which is a sound frequency device.
Hi, I'm Jody Susan.
Well, a little technical issue there, but he is the creator of the BAUD. Which is the bioacoustical utilization device. We're so excited to have him here today. And we're going to be doing 3 short segments. The first one here is relief from pain, stress, and anxiety, how to put the brain in a theta state. And that's using sound frequency, which is based in shamanic drumming. So without further ado, I'm going to add Dr. Frank Lawless to the stream. And I know that we were having some audio, so we might have to pivot or adjust a little bit, but please don't worry. Here we go. Dr. Frank, how are you? We are live. Can you hear me?
Tell her you cannot hear her.
Still cannot hear you.
Okay, all right.
Let me.
Tell her you're going to go out.
I'm going to go out and come back in.
Awesome. That's a great idea. Thank you.
Okay, so now let me help you.
And while Dr. Frank is getting out of the system and coming back in, I'm going to tell you a little bit about the BAUD and how I used it. And I continue to use it not only personally, but also with others to help them get relief from pain, stress, and anxiety. And Dr. Frank is going to talk about how the BAUD puts the brain in a theta state. So I had pain in the levator scapula, which goes through here all the way down under the shoulder blade. I had pain there for nearly 2 decades. I want to say probably 19 or 20 years. That's fairly safe. I had an accident in 1997. And it was at work, and I fell down and tore my rotator cuff. And over the years, I didn't have enough strength to use a hair dryer, to hold a hair dryer to blow dry my hair. So I didn't use a hair dryer or own one after that for 2 decades. And when I met Dr. Michelle Kukla, a Healthy Living Counseling Center, she had introduced me to the BAUD. She is a doctor of psychology, and we started using it, and we used it for several years. I was disabled at the time, and seeing her and others to reclaim my health. So that included, sound frequency, psychology, seeing a therapist, seeing a chiropractor, acupuncture, clean food, things like that. Even after years of therapy and work, my pain in the levator scapula still was present. And when I finally went back to work, so I was disabled at the end of 2013, went back to work first quarter 2017. And the very first thing that I purchased with money, because I was on disability, it wasn't really my money, using my health savings account was the BAUD, okay? Because it's basically $500 door to door, $503 with tax. So I bought this because I wanted to be able to use this at home and handle all my stress being on a phone call. So instead of wearing it on my ears, I would wear the BAUD on my thigh. But it occurred to me, because Dr. Michelle Kukla was she's so out of the box in her thinking. She said, well, Jody, you want to pair the BAUD with different modalities, and you want to, if you have pain, you want to have kind of like trigger the experience or the discomfort or pain and wear the BAUD at the same time. So I took the BAUD with me to somebody who does muscle activation technique, And what he did is he activated the area in the levator scapula and other places in the body, because I'm not trained in MAT, but he is trained in MAT, and he knew what areas of the body were triggering the levator scapula. While he was doing that, we wore the BAUD at the same time on the ears, and we communicated with thumbs up, thumbs down, things like that, because of course you can only hear the BAUD. So it takes a little bit of training and some footwork, some fancy footwork. So that was in 2017, in May of 2017, that he worked on me. And I have not had pain in my levator scapula since that time. Why is that the case? Well, because this also reverses or removes the cellular memory for in the area of the body that you're working on. So for me, it was the levator scapula. And I've never had pain in the levator scapula since. And I can blow dry my hair if I choose to, but since I have curly hair, I don't really have to worry about it. Now it looks like we have Dr. Lawless back on in the green room, and we're going to see if we have audio. And I'm really grateful that I was able to share my personal story about getting rid of pain using the BAUD. So let's see. Dr. Frank, can you hear me now? You can hear me?
I can hear you fine. Thank you.
Yay.
Yeah.
So that's awesome. So while you were
Yeah.
working on technology, I want to tell you that I gave the quick story about how I reversed the pain in my levator scapula that I had there for 2 decades. And we used it by using muscle activation technique, which works with, the neurons in the body. And we paired it with the BAUD. And I haven't had pain in my levator scapula since May of 2017. And today is January 24th of 2022. That's a long time, especially given that I was in pain for 2 decades. Same place, no resolution. Now that I've shared the story and what's possible, can you share how is it the BAUD is working to help people
Okay.
from pain, stress, and anxiety, and how it puts the brain in a theta state?
Okay. This is sounds complicated, but it's really pretty simple. What I learned was that what I had to do was, in order to reduce pain, I had to basically find a way of reducing anxiety, reducing depression, and basically creating new passages for joy. And the way I did this was find a way to do this directly to the brain. Now,
It looks like we may have froze for a second, but we're going to ask God to intervene here.
let me turn this.
Okay, so you cut out for a second. Go ahead. So we'll
Okay.
reverse. We're creating new
So I'm going
passages.
to tell the story of how I kind of learned how to do this from a shaman. And basically what I did was went to this shaman workshop. It was kind of accidentally one of those divine interventions that we talk about. And I kind of ended up by accident. And so I listened to the shaman's story about what he uses in rituals and so forth. And afterwards, I asked him, how do I deal with pain itself? And so he taught me how to beat a drum at a certain cadence. And what I learned when I went back to the pain program, I discovered that I could beat the drum and my patient's pain would be automatically reduced. So being a scientist at nature, I basically created the BAUD, which could do more than just beat the drum, but could create other kinds of ways electronically. And so this is how the BAUD is set up is that you have one vibration, one frequency going in one ear and one frequency going in the other ear. And so when you basically create an interference between the one ear and the other ear, you create a frequency. And so I found a way of create a frequency that basically creates a different pattern that you're focusing on. So how this works is that you basically find that frequency that creates the pain signal. And you have to do this by allowing the patient to basically find that frequency by creating different inputs in terms of the ears. So this basically is dividing the right and left ear, which is the left hem knob, where you create actually more pain. That's kind of the difficult part of the therapy, is creating more pain. And then after you find that frequency that relates to the pain, and that pain may be anxiety that has to do with physical pain or emotional pain. What you do then is you find you create by just changing the knob and the frequency between the two ears, where the pain resolves itself. And that's basically it. Now, the interference of these two frequencies that are going in the right ear and the left ear overlap each other. And so you have one frequency and then the other overlapping the other frequency. And the result is theta, theta phrase. And you'll kind of hear the woo, 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 woo sound in your ears, or in your brain, should we say. And that creates a different pattern for that pain. That's kind of sounds magical, but that's kind of what happens.
When you're creating a different pattern for the brain or for the pain, what does that look like? Can you explain for the layman?
Well, what it looks like, if you were to put a oscilloscope on it, is you have two patterns going into the ears, and so you create a third pattern, which is basically the overlap. And you can
the right and the left, right? So the pattern on the right, the pattern on the left, they come together and create a third pattern, and that pattern puts it in the theta state.
Yes, that's basically what happens.
Let me ask you an important question. Oftentimes, so when I used to have stress being on phone calls with certain people. And so what I did is I used the BAUD, and I put the BAUD on my thigh, or I would put it like, my shoulder, or somewhere where no one would ever see it while I'm on a phone call. So it helped me relieve my stress and anxiety. Can you explain to me and everybody else why that works? Because it's not using the ear.
Well, basically, it's the same principle, except that you're putting it on another part of the body, but the frequency still remains the same, and that is that your perception of those frequencies is also felt in other parts of your body. For example, when people are having hearing problems, and we use the bone conduction microphones, so instead of them hearing the sounds in their eardrums, what they're doing is basically hearing it through the bones. And that has the same effect, because then it also relates to the passages that relate to your pain. So you're still changing the pattern, regardless of what part of the body that you're using.
Because it's a frequency. It's a vibration, correct? Can you hear
That's
me?
true.
Okay.
So the vibrations or the frequencies can go through your skin, go through your bones, or go through your brain, eardrums.
Awesome. So I had one other question for you about this. Oh, yes. Is there a specific frequency, a specific dial that you want people to use when they're trying to achieve a theta state?
Well, there are 4 dials on the BAUD. The 2 bottom ones have to do with the frequencies, with the volumes of each ear. So those 2 relate to how you're balancing out those frequencies. And sometimes our patients find, especially if they're have different kinds of hearing losses in one ear or the other, that helps them regulate that sound so it's more balanced. Now, the upper 2 knobs are quite different. The upper right knob is basically where it basically changes the frequency of both ears at the same time. Mm-hmm. So what we often do is we use the left side of the left upper knob as at a 0, which means that there's no difference between the 2 ears, the left and the right. And so you're basically, when you turn the right upper knob, this is getting confusing. I hate
no, it's not. It's actually
go with that. But when you turn the upper right knob, what you're finding is the frequency of the pain in both ears at the same time. So you will basically be on a journey where you find the pain that's in your brain, that frequency, and then when you find that, then you turn their upper left knob, which will separate the 2 ear frequencies, and then you find that disruption. We call it the disruption knob a lot, where you just find that frequency between the 2 ears that basically reduces the pain or anxiety.
Or eliminates it. It disrupts the current reality, right? That's why we're calling it a disruptor. Yeah,
that's why. Okay. So it's amazing. It's amazing what it will do in terms of when you want that brain disruption. It doesn't, I want to make it clear, it doesn't decrease the memory. You still have the memory of the trauma. For example, if you use it for PTSD, you have the same interaction that's happening. You find the frequency of the emotional pain, and you use the disruptor to diminish that frequency. Where it diminishes the emotional pain or physical pain. So whether or not you're talking about craving, like an addiction, or whether you're talking about emotional pain or physical pain, the formula, not the formula, but basically what we call the protocol is the same.
Right. And so to add to that, yes, and right, what it's doing, so you still have your memory. What it does is it removes the trigger or the overreactive response or reaction to this event or events that are similar to it. So you are now in control of your emotions. So this is
sometimes I use the metaphor of kind of like a radio, where you dial up the pain and then you diminish the pain. It's a simple protocol, and I've used it on children at the ages of 4 or 5 or 6, and still got the same results.
Well, I think that children would be easier. They have less baggage. As opposed to like, my age, right? So I had more baggage when I came across this when I was 50 years old. So a 4-year-old should be cake in comparison to me starting to use this as a 50-year-old. So we're gonna, is there anything else you want to say relative to the theta state, pain, stress? Because we're gonna come back and do other topics today. And actually, the other topics are, let's see here. We're going to talk about on the next one, how to use the BAUD for ADD and ADHD. And there's, I think, one or two others, but for right now, is there anything else we should address regarding pain, stress, and anxiety? Anything else?
Yeah. Well, basically, it also diminishes the some factors of PTSD as well as some depression factors by diminishing the effect of past memories, of past experiences, should I say. For example, many people have memories from their past that evade their present situation, like, for example, being abused as a child, or being abused at the workplace, and even like automobile accidents. So there's various kinds of approaches that still lend themselves to the same protocol, and that is getting the brain center that you want to address, and then diminishing the emotional components that relate to that factor. So you can, there's various other kinds of approaches that I have learned actually from my patients that have worked. And I mentioned craving on alcohol or other substance abuse.
So is cravings also associated with the theta state?
Yes, they're all related to relaxing the brain pattern, so it's not doesn't have that anxiety factor that's associated with it. So you have craving, you have phobias, you have various other kinds of experiences and trauma that you need to reduce the emotional content.
Awesome. So we are going to come back here in a few minutes, and we're gonna discuss more. We're so excited to have you here, Dr. Frank, and to have you share your knowledge. And let's come back and do a deeper dive on ADD and ADHD. So I will see you in a few minutes, because I'm going to end this segment and we're going to go to our next segment. Sound good?
It sounds perfect.
All right.